Okay, so my question is paracetamol a beneficial treatment in sepsis? So answering this question is part of evidence-based practice. So that's a process of sourcing research, analysing it, interpreting it, and then implementing it into clinical practice. And evidence-based practice is important because it improves clinical practice. So here we're actually trying to find whether or not paracetamol is effective in the treatment of sepsis. So, you know, that is going to improve clinical practice, it improves work environment, and it also would improve a patient outcome, obviously depending on what our findings are. So to answer the question, I've got to determine what it is it's asking, where I'm going to go to find the information about what it's asking, and then how I'm going to evaluate whether or not that information is valid. So some background info on paracetamol. It's an over-the-counter medication, so it's relatively safe to use as long as you take it as per the instructions. It's an analgesic, so it relieves pain, and it's an antipyretic, which means it relieves fever. Sepsis is a life-threatening condition when an infection reaches the bloodstream. Symptoms include low blood pressure and an elevated heart rate and rest rate. Patients will also be febrile. Treatment includes IV antibiotics to treat infection and IV fluids to restore hemodynamics. Okay, so when I'm looking to find this best scientific evidence, I've got to consider the hierarchy of evidence. So as we move up this pyramid here, the kind of level in confidence or the quality of evidence increases. So down here, this is kind of all just data. So this is like a primary source, it's unfiltered. You know, things like randomized control trials, they're still peer reviewed and have methodology that can then be replicated, but it is one trial that has one result kind of thing. So what a systematic review does is it's considered a filtered source. So it considers all of this data and it actually comes up with a result and a conclusion as to whether, say, a treatment is effective or isn't effective. Alrighty, so to conduct this research, what I'm going to do is identify the keywords. So I'm going to do that with the PICO framework. So that's going to help me with my literature search. So I then need to select a database. So in that case, I'm going to use CINAHL and Medline because they're identified as appropriate for nursing research because they're the journals that they subscribe to and collate. I'm then also want to set some limits around my search. So I only want to filter results so that I'm retrieving the most relevant and current and highest level of evidence. So now what I want to do is look at my PICO framework. So from the question, I've identified that the problem is sepsis, the intervention will be paracetamol, the comparison is no paracetamol, and the outcome is an absence or reduction in sepsis symptoms. So my alternative keywords that I kind of came up with through my background research are listed here as well. But with my search in the database, I'm not going to use the comparison and outcome keywords because they're not going to help me actually drill down into that evidence that I need. They're going to make it too broad. So the next step is to actually go and conduct the conduct the research. Okay, so I've gone to the UAW library guides and then to medicine and health. And then it's, as I said before, suggested CINAHL and Medline to use. So I've got my keywords here. So paracetamol and alternates, sepsis and alternates. I've also added systematic review. So I'm searching for all of these keywords in the title because I want the literature that I return to be descriptive of what it is, because that's another indication of good quality evidence. and I want it to contain all of these keywords. So I've searched, pressed that. Here's one I prepared earlier. So it's just returned one result, which is great because it's the document, the journal article is an antipyretic therapy in critically ill septic patients, and it's a systematic review. And you can see here it's an academic journal. So great, that's what I want. So it took me a while to get here. I initially hadn't included antipyretic therapy and antipyretic medications. And it wasn't until I kind of identified that those terms were going to return that higher level of evidence that I was actually after. And then, of course, adding systematic review as well, because there was a lot of random control trials that there was research about. But to answer this question, I actually want a systematic review. So there's not a copy of the document here. So I had to take the title and I actually went to the library and just searched the title name. So here's a copy of the article. And we're just going to go back to the presentation and I'll show you how I analysed and evaluated the article so that I was happy to use the information from it. So the objective it outlined was to examine the impact of antipyretic therapy on outcomes in adult septic patients. The method they used was so random control trials and observational studies on the effect of antipyretic therapy on mortality in septic adult patients were included. So everything else was excluded. So it's just adults with sepsis. And so 2 academics independently reviewed the literature. So the results they found were that antipyretic therapy did not reduce a 28-day or hospital mortality in the random control study or the observational studies. The antipyretic therapy decreased body temperature by less than 1 degree Celsius, but did not decrease the heart rate or rest rate. And they actually concluded from their systematic review that the antipyretic therapy does not significantly treat sepsis. So there we go. There's the answer to our question. Paracetamol is not an effective treatment for sepsis. So as per evidence-based practice, that's information that I could then go and implement in a clinical setting. So let's reflect on the process using the Rolf model. So what I did was I conducted research to identify the highest level of evidence. And as I mentioned, that was really tricky. It took me a while to actually identify those keywords that were going to bring back that information that I needed. So that was quite a challenge. But that was a good experience. So sourcing the highest level of evidence is an important skill. So it kind of, the experience has taught me that it's really important to have that really good understanding of what it is you're trying to find an answer for, so that you can get the concept, get the keywords, and actually return that information that's going to answer your question. So the whole experience has been good. It means now I can use the PICO framework when I go to do my research essay for my next SNUG202 assessment. And, I've also got a bit more confidence and kind of trust in the fact that evidence-based practice is actually practical, in a clinical setting. And yes, and I'll just flip to my references and that is it. Thank you.